Hi, I'm Brandy. I'm doing video checkoff number 4 on the ezpap, video checkoff number 4 on the percussion, and video checkoff number 5 on the vest. First, I would check to see what my order is with my patient. We're going to do percussion. So I would go and check my order, check the history, if there's an x-ray, meds, therapies, check all that stuff, any allergies on my patient, get to know my patient a little bit. Then I would grab my percussion machine that we have here at the hospital. Then I would knock on the door, address myself, tell the patient what I am doing, that we're going to do percussion to help break up that secretions in those lungs and that fluid. I would get the permission from the patient, wash my hands, do vital signs, and listen to the lung sounds, the front and the back of the patient. Once that is done, I would explain to the patient that I either need them to set up, lay on a side, they could lay on their tummy, but I need to get both the lung fields in the back and not go over the bony providence, because that can really hurt them. And then we're just going to do on a 20, there's a 30, a 40, and a 50 on the speed of it. Once that patient is positioned, we're going to just do on the side right now. And I'm going to do 20. And I'm just going to go over the lung fields like that. And then I would do vital signs again, and I would listen for the lungs, ask the patient if there's anything else I can do for them. I also would make sure they have their call light, any questions or concerns they have. I wash my hands and go chart that procedure. The next procedure, I'm going to do an ezpap. Actually, I'm going to do the vest first. Video 5 on my vest. I would check the history on the patient, checking to see what history, what procedures, anything like that, any allergies, medications, get to know my patient a little bit, see the chest x-ray, and then I would grab my vest. I would also grab my machine, and it won't be plugged in at that time. I would go to the patient's room, knock on the door, dress myself, tell the patient what I'm going to be doing, that we're going to put the vest on. I would, if that's okay with them, they would agree. I'd wash my hands, do their vital signs, listen to their lungs. Then I would have them set up in the chair, help them if they need. And then I would put the vest around their lungs. So that way it really vibrates in those lung fields. And then these bottom sections here, you would hook your tubing to, and then you would plug your device in once these are hooked up, and then you would push the start button. And as you can see, it is going to throw that vibration through the vest, and it's going to just vibrate through there. Our machine's set at 50% FiO2 at 20 minutes. Once that's done, it's on an automatic timer. It will shut itself off, but we're going to shut it off right now. And then I would do vital signs again, listen to the lungs, ask the patient if there's anything I can do for them, if they would like to lay back down or stay where they're at. if they have any questions, concerns. If they were to need to use this machine again, I would leave the vest and the machine in the room. I would wash my hands, go chart that procedure, and then I would go to the next procedure. The next patient is going to be an ezpap. It was a surgical patient, just could not understand and get the pressures on the incentive spirometer up there. So we're going to look at their history, at their x-ray, just to see if they have atelectasis. A lot of times if they do, this is a good device to use. I would have my rubber band set at 20% water pressure. They will get a good seal on the mouthpiece, and make sure the procedure's into the computer. I also would check their meds, their labs, their chest x-ray, their history, get to know my patient a little bit. And I wash my hands, introduce myself, tell the patient what am I doing, that we're going to do this little device called an ezpap. We're going to get a nice good seal on there, and we're going to breathe in nice and slow, and then breathe out real not forcefully but deep. Exhale into the machine, and then breathe in through the machine, and then breathe out through the machine. We're going to do several of those. I will be the patient, so I'm going to turn this on 5 liters. First, I would do their after I wash my hands and explain the procedure, I would do their blood pressure and listen to their lungs before. And then the patient's going to do the procedure. They're going to set up on the edge of the bed, or set up in bed, or on the chair. Once that's done, I would do blood pressure, listen to the lung fields again, and see if the patient's comfortable, lay them back down if they want to be laid down. If they have any questions, concerns, wash my hands and go chart that procedure. Thank you.